If you're a parent or a grandparent, you can probably relate to this home video we recently received from a concerned mom named Jen.
Hi doctors, I'm a busy mom and I spend most of my time driving my son Cooper back and forth to school and baseball practice. It is my life. He really loves playing sports and would like to give football a try. I'm worried about letting him play a sport that has a lot of running because he has asthma. What should I do?
Well, Jen is here with her son, Cooper. Thank you.
Oh, you're welcome.
And we also have Minute Clinic family nurse practitioner Meredith Dixon to help talk about the importance of sports physicals. And there's a reason we're talking about this. 30 million children and teens participate in some form of organized sports. And more than 775,000 children aged 14 and under, they end up in the ER for a sports-related injury every year. And that's why a sports physical or a pre-participation physical is so important.
Yeah, exactly. And why is a sports physical so important? First off, we use it as physicians to identify young athletes that have problems that might be undiagnosed before they become problems on the sports field. I also talk about certain training tips, meals, hydration, sunscreen, important stretching depending on the sport, things like that. I also like to talk about equipment for that particular sport. If it may be like a sport like football, all the equipment's usually taken care of, but some equipment like running, the parents are usually responsible for the shoes. So I always make sure, hey, make sure you're prepared to spend some good money on some good shoes for your child's growing legs.
It's also a good idea to make sure that you're planning for the physical. So I would recommend making sure you get out there at least 6 weeks prior to the sport actually starting. The reason being is if something is identified, it's really important that you build in time to have follow-up appointments.
Pretty much every season, most states or youth sports organizations require a new sports physical at the beginning of every season or before you're going to start a new sport.
Okay. And you can go to your pediatrician's office, your family practice doctor's office. Some schools provide exams or even some retail health clinics. Right, Meredith?
Yeah. Minute Clinic is a medical clinic inside CVS Pharmacy, so it's a great option for moms on the move. We're open 7 days a week. You don't need an appointment, so moms don't have to take off time from work. Children don't have to take off time from school. We are staffed by board-certified family nurse practitioners and physician assistants, so we can diagnose, treat, and prescribe if medically necessary. So it's a great option to come to us.
There you go.
So real quickly, what do you do during your sports physical?
So for a sports physical, it's very important to bring the forms that are required to be filled out, as well as an immunization record. So we'll sit down and we'll review the immunization record, make sure everything is up to date, go through a thorough health history. We'll take all the vital signs, the height, weight, blood pressure, listen to the heart. We'll go through a full head-to-toe physical, and then we'll sit down and go over the summary of those results. So if anything is abnormal, we'll want to make sure that you understand what's going on. We also like to, with your permission, send that record to your primary care physician. That's really important to note that the sports physical is not a replacement or substitute for your child's annual physical exam.
Yeah, try to fill out those forms ahead of time before the appointment because sometimes there's a lot of questions to go through and it'll give us more information to work with.